Aloha. Thank you so much for joining us for today's Hawaii Pacific Health webinar focused on financial wellness for cancer survivors. My name is Valerie Ferguson. I'm here to facilitate today's conversation. We have assembled an expert panel of speakers to help provide guidance on financial matters faced by cancer survivors. Before we get started, a few reminders for our viewers. Today's webinar will be recorded. After the event is complete, registered participants will receive an email at a later date with a link to the recording. For those joining us live, please feel free to submit questions using the Q&A button at the bottom of your screen. We will do our best to answer as many questions as time permits during the Q&A. Our first speaker is Flo Kamai. She is a financial counselor at Polimomi Medical Center and has been employed with the company for 19 years.
Aloha, everyone. Welcome. As Valerie mentioned, I am a financial counselor at Polimomi Medical Center. When I was asked to speak at this cancer webinar, I thought to myself how appropriate that it will be that I'm speaking to you today, as I have a loved one who has been battling cancer, in fact, for the past 14 years. So I know firsthand the roller coaster of emotions and financial worries that may arise as you go through your cancer journey. But we here at Hawaii Pacific Health are passionate about our patients and the quality of service we provide them. So I'm happy to share with you today about our financial assistance program. Eligibility requirements. All Hawaii residents, including those with insurance, are eligible to apply for financial assistance. Non-residents who receive emergency care are also eligible to apply for financial assistance. Who is able to apply? Those that are financially indigent. That is defined as someone who is uninsured or uninsured, underinsured or uninsured, whose annual income is equal to or less than the federal poverty guidelines. Now, patients with family income at or below 200% of the federal poverty guidelines will receive 100% discount free care. Also, patients with family incomes ranging from more than 200% up to 400% of the federal poverty guideline will receive an 85% discount on their current balance. Now, I'm going to jump forward to the 2024 poverty guidelines. Now, the U.S. Department of Health and Human Services issues the poverty guidelines in the Federal Register. However, it is the U.S. Census Bureau that determines the federal poverty level annually based on a household size and income. Now, it is this guideline that we use to determine a patient's financial ability to pay for services. So as I mentioned earlier, patients and family that have a family income at or below 200% of the federal poverty guidelines will receive 100% discount. So looking at this chart, for example, a family size of 3. If your income is at 200% or less of the federal poverty guidelines, so 59,380 or less, you would be eligible for 100% of your balance of your bill, or basically free care. The other portion of the financially indigent patients are that anyone who is between 200% or 400% would be eligible for 85% of their bill. So again, looking at the chart for a family size of 3, if you are within this annual income of 59,380.01 or 18,760, then you would be eligible for 80% discount off of your current balance. Now I'm going to jump back to the previous page. Oh, excuse me. Also, those who are medically indigent are eligible, and they are defined as someone whose medical bills are is a significant portion of their income and threaten their household financial stability. So these patients with family incomes higher than 400% of the federal poverty guideline, if you have a balance that is 15% or more of your combined annual family income and liquid assets, then you will be eligible for 85% off of the balance of your bill. Now, some of you may be wondering, what is liquid assets? Liquid assets are cash on hand, cash in the checking or savings account, stocks, bonds. These are assets that can be quickly and easily converted to cash. So that, along with your annual family income, if it exceeds more than 15%, then you would be eligible for 85%. So let's go to the chart. Again, we use the example of a household of 3. If your annual family income exceeds 118,760, then that, along with your the liquid assets, if your balance due exceeds 15%, then you would be eligible for 85%. Now let's go back. And some of you may be wondering, how can you apply for financial assistance? You can call our billing office directly at 808-522-4013. You can also visit our website at hawaiipacifichealth.org/FA program. There's other ways that you can also obtain a financial aid application by emailing our billing office at billing@hawaiipacific.org. Okay. Now, this is a document checklist that is also attached to the financial aid application with some of the documents that is required when you submit your application. We would need a patient's income verification, pay stubs, most recent W-2 form. If you're self-employed, then we would need your GE tax form, Schedule C, and/or profit and loss statements, Social Security, 1099 form. If you're unemployed, it lists the documents we'll need. So these documents listed here would only apply if you're in that category. So if you're receiving Social Security, then we would need a copy of Social Security or a benefit award letter. So this is just an example of some of the documents that we would need. Okay. And in closing, here is a list of the financial services offices at any one of our facilities. If you're having service at any one of these facilities, by all means, please give them a call, and we will be more than happy to help navigate you through the application process. Okay. Thank you, everyone.
Thanks so much, Flo. So our next speaker is Darren Leong, and he's an attorney practicing in the area of employment and labor law. He has a broad range of experience relating to employment issues and healthcare institutions.
All right, thank you so much. let's just jump right into it. This relates to employment rights and how to navigate your employment during your cancer treatment and if there are limitations after. Go ahead, next slide. Okay, so there are a couple of types of leaves of absence that you may end up taking uh, when you need leave for treatment or for recovery after. So the first and obviously the best one is some type of paid leave, and they come in various forms. So many employers use what's called PTO, it's paid time off, and that is paid leave that covers sick, it covers vacation, it generally covers everything. Most employers will allow you to use your PTO when you are out for treatment or recovery um, or um, related to your limitations. The other type of paid leave that is instead of PTO typically comes as both sick leave and vacation. So many employers use a combination of a sick leave bank and a vacation bank. Typically, sick leave is supposed to be when you are ill or sick, but in many instances, the employer will allow you to use your vacation as well while you are out recovering or needing time off due to cancer care. So a pointer would be to see all the paid leaves that you can potentially use so that you can be paid while you're out. Many employers also have leave donation programs, which are programs where other employees will donate their PTO or they'll donate their vacation or their sick leave into a bank to be used by folks with serious medical conditions. So cancer would be included in that. So it's worth looking in to see if your employer has a leave donation program, because once you run out of vacation or run out of sick leave or PTO, then you may be able to keep going on a paid leave using a leave donation program. Another type of paid leave is what's commonly referred to as TDI, which is temporary disability insurance. And that is mandated by law for virtually every employer. So temporary disability insurance would be separate and apart from PTO, from sick, from vacation. And it's something that your employer will have and that you can just ask them, hey, can I apply for PTO? It will typically cover 58% or up to 58% of your wage as a wage replacement, up to certain limitations. It's not forever, caps out at a certain amount. And that can continue for up to 26 weeks. So TDI is another type of paid leave that you should just ask your employer, am I eligible for that? How do I apply? That sort of thing. And then the last one is a long-term disability policy, which is something that is not required by law, but many employers do it as a perk to the employees. So the employer will get a long-term disability policy that applies to all the employees. And if you are out for a certain length of time, there may be payments from that long-term disability policy. Okay, next slide. One thing also to note is these various types of leaves, whether it's paid leave and different types or unpaid leave, can often be combined or supplemented. So for example, in the last slide, if you have TDI and you're getting part of your total wage, many employers will allow you to supplement the rest of it. So for example, if you're getting 58% of your wages, the employer may allow you to use vacation or sick leave to cover the other 42% or so. On top of paid leave, a big issue that often comes up is unpaid leave. So there are a few ways in which you may be entitled to unpaid leave to recover or for cancer treatment and that sort of thing. The most well-known one is probably FMLA, which is the Family Medical Leave Act. And that provides up to 12 weeks, which is essentially 3 months of unpaid leave so that you can recover from treatment, illness, etc. FMLA also provides that the employer is supposed to continue your group health insurance coverage on the same terms that you had it at the time you took the leave. And it is also protected. So employers are not supposed to penalize you or take action against you for taking those 12 weeks of unpaid leave. The law only applies, however, in certain conditions. So FMLA is for relatively large employers. It's employers with 50 or more employees. And the person seeking to take the leave has to have worked a pretty considerable amount in the past 12 months. So you need to have worked 1,250 hours in the past 12 months to qualify. All of that will be vetted by just putting in an FMLA application to your employer. So really what you would need to know is go and ask, am I entitled to FMLA for the time I need off for treatment or for recovery and that sort of thing. And that is an unpaid leave. FMLA can be combined sometimes with paid leave so that you're taking FMLA and also paid leave. Okay. The Hawaii Leave Act, or what's called the Hawaii Family Leave Act, does not cover leave for the patient themselves. That law covers leave to care for a close family member with a serious medical condition. So if you're a family member, then you might look into that type of leave applying. And then the last one is leave as a reasonable accommodation, which is in addition to FMLA. So if we can go to the next slide. So a common misconception is that once FMLA expires, so say you take 12 weeks of leave, that you're no longer entitled to any further leave. That's not necessarily true. And it requires both you and the employer to go and figure out whether you may be entitled to some additional leave or other accommodation. So the additional time off would come under the Americans with Disabilities Act. And that's called the ADA for short. Hawaii has essentially an overlapping law that covers pretty much the same stuff. And the ADA requires an employer to provide what's called a reasonable accommodation. And so the main takeaway here is, even if your FMLA expires, what you should do is go to the employer if you need more time off for recovery or treatment or that sort of thing, and raise the issue directly with the employer so that it's on the table and say, hey, I know FMLA has expired, but am I eligible for a reasonable accommodation? And I need a leave of absence or some other thing. And then to have a discussion with the employer about that. Because it may be the case, it's not necessarily, but it may be the case that you might be entitled to some additional time off, unpaid, as a reasonable accommodation to recover from cancer, etc. You will need almost certainly a medical certification from your doctor saying what your limitations are and providing what your doctor views as your return to work or your ability to return back. There are some other reasonable accommodations that you can discuss with the employer, which include intermittent leave, which is taking time off, then coming back, and then taking some time off, and then coming back, depending on what the needs of treatment are. So in some scenarios, chemo treatment, you might be unable to work for a certain period of time, and then you recover. But then when the next round of chemo happens, you're unable to work again. So that would be intermittent leave, and that's something to discuss with your employer as well, both from an FMLA perspective and an ADA perspective. Others would be modified hours, like shortened hours, physical assistance or ergonomic modifications, like if you have some neuropathy from some of the cancer treatment, maybe something to do with the keyboard or other modifications to the workstation. Another accommodation could be working remotely, and another would be job transfer. All of these are going to be dictated by what your doctor says and the conversation between you and your employer about what works, like what would be feasible, what would be reasonable. So the takeaway is have the discussion with your employer so that it's on the table, and that everyone knows what you're asking for or what you're suggesting. Don't let it be silent. And then last slide. And then finally, there are some just general rights that apply to protect you from taking these protected leaves or taking advantage of, say, the ADA reasonable accommodation. So employers are not allowed to retaliate for taking FMLA leave or protected leave. They're not allowed to terminate you because you have cancer. They're not allowed to deny FMLA if you're entitled to it. And they're not allowed to deny a reasonable accommodation if it truly is a reasonable accommodation. There are other situations where if there's a separate reason, like a layoff or something like that, that could be, just a separate issue and not in play. But certainly employers are not allowed to fire you or suspend you because you're disabled or because you took FMLA. Okay, thank you very much. I'll be around for the Q&As at the end.
Thank you so much, Darren, for that helpful information. So we're going to go on to our next speaker. We have Gilda Abbas. Gilda is a social worker at the Dr. James Kakuta Cancer Center at Polimomi. She's been in her current role for 5 years, assisting patients with overcoming barriers and connecting patients to community resources.
Hi, everyone. Health insurance is a significant factor that contributes to the financial burden for many of our patients. We often hear our patients tell us that they worry about losing their health coverage or not being able to afford their health insurance when they're diagnosed and going through treatment. There are different health plans. There are individual insurance plans, and then there are also employer plans. The individual plans you can purchase directly through an insurance provider or through the state's health insurance marketplace. And then there's the employer plan that you typically will get provided to you by your employer. Then there are also the government-sponsored plans, such as Medicare and Medicaid. Medicare is the federal health insurance program that's available to individuals who are at least 65 years old, have been receiving Social Security disability insurance for more than 24 months, or have end-stage renal disease or ALS. There's also Medicaid, which is the federal health insurance program that's administered by states. This one is based on eligibility, income, and also based on assets. When there are decisions about taking time off or switching jobs or stopping working entirely is overwhelming, but there are options. As Darren had mentioned earlier, we encourage our patients to talk to their employers, ask about your employee benefits, ask about the FMLA, which is the 12 weeks of unpaid leave, ask about TDI, the temporary disability insurance, that provides up to 26 weeks of paid leave. And then there's also COBRA, which is the federal law that allows eligible employees to keep their employer-sponsored insurance for up to 18 months. The cost of COBRA insurance will vary between employers, so we encourage patients to talk to your employers about what your benefits are, and what that may look like. Another option is applying for Quest insurance. Quest is the state insurance that is based on income and assets. There are 3 ways to apply for MedQuest benefits. One, you either submit an application online. 2, you can apply by phone by calling the MedQuest call center, or you can do the MedQuest paper application, which can be downloaded online and turned into the nearest processing office. Another option for insurance is purchasing an individual plan through the federal marketplace insurance. You have a choice between purchasing different plans based on your need. Oftentimes, insurance plans on the federal marketplace insurance, they're cheaper than going directly to the insurance provider. Most people will qualify for tax credits that helps lower the monthly premium. Marketplace insurance can be applied 2 ways, either by telephone, calling them directly, or visiting them online at healthcare.gov. So there are a couple of things to consider when you're choosing your health insurance. Ask yourself, what will the plan cost? Are my healthcare providers and the facilities that I visit or go for doctor's appointments, are they included in my plan and included in the network of this insurance? And does the plan cover my prescription drugs and the pharmacies that I use? So when choosing a health insurance, it's overwhelming and there are different options, but we encourage you to talk to your healthcare team, talk to your employer, and we can help guide you and steer you into the appropriate directions. And these here are resources that are helpful, and many patients and families have said that these resources has helped them greatly. So there's Cancer Finances Health Insurance, Triage Cancer, MedQuest Online, Health Insurance Marketplace, or Hawaii Ship. Very helpful resources to go to when thinking about health insurance options and plans.
Thank you, Gelda. Our next speaker will be Noelani McGuire. She's going to be talking about prescription drugs and pharmaceutical assistance. Noe McGuire is an oncology nurse navigator. Noe's nearly 40 years of combined nursing experience in both NICU and as a nurse educator. Noe joined oncology in 2016 and focuses primarily on breast cancer. She co-facilitates the HPH breast cancer support group.
Good evening, everyone. Thank you for joining us this evening. I would like to talk about some of the financial toxicities. And financial toxicity is a term that's used to patients who face financial challenges along with their families due to the high cost of cancer treatment. Studies show that 3 out of 4 people with cancer worry about how they will pay their cancer treatment along as their day-to-day costs. As I'm sure you folks are aware, cancer treatment is expensive even with health coverage. A recent study done in 2013, which is still current today, indicates that 42% have a significant financial burden. And so what they need to do is they have to adjust their life. And as you can see, they maybe won't fill their prescription medications because they have to buy food or pay for their insurance. And they just have to adjust, decrease spending in food and leisurely activities that are essential for life balance. And so here at HPH, we do have a specialty pharmacy at each of our entities, which is Hawaii under Hawaii Pacific Health, Palimomi, Straub, Benoff, Kapiolani, as well as Kauai. And what this specialized team does is they help you to obtain your oral and some injectable medications that are covered and approved by your insurance. They will apply you and they'll receive help to see if you qualify, kind of what Flo mentioned earlier. They'll also assist with refills and renewals. So what happens is your oncologist will write the prescription. It will trigger our specialty pharmacy and they will kind of look into it and then they will connect with you. And so should that transpire, that come about, the hardest thing for them is connecting with the patients because it's a number that you folks are not familiar with, so you won't answer it, which of course is totally acceptable. But they do need to connect with you so they can move forward to apply you for certain medication resources such as copay cards for patients with private insurance. There's a bunch of grants out there, HPH Internal Foundation, and then the manufacturer company itself that produces the drug. In addition to our specialty pharmacy, we have an oncology liaison at each of our facilities, and they work closely with our team, with the physicians, with our nurse navigators, our infusion team, and they also help to get medications that is not, I guess you could say that the specialty pharmacy doesn't cover. So for examples, the injectables that the pharmacy doesn't assist, as well as the intravenous medications covered and approved by your insurance. So they are also very helpful and they will help you look for what you qualify for with the same things such copay cards, grants, the HPH Internal Foundation, and the free drug. So, again, it's essential that we all work together, but these are some resources that are out there. The American Cancer Society, Catholic Charities, Gilda mentioned Triage Cancer. It's a great facility, the United Way here locally, 80 Cancer Care, and then Making Lemonade, which is a local grant, if you will. It's a Make Lemonade project, and you folks are going to learn a little bit more about that in a minute. Thank you.
Thanks so much, Noe. So as Noe mentioned, our next presentation was going to be with the founder of the Make Lemonade Project, Kelsey Nishi Darling. Unfortunately, Kelsey is unable to join us today, but we still wanted to share information about this amazing organization that strives to be a symbol of hope, resilience, and strength for cancer survivors. Here is a beautiful video explaining their purpose.
Hi, my name is Kelsey Nishi Darling, and I am the Executive Director of the Make Lemonade Project.
Hi, my name is Michael Darling, and I am Kelsey's husband, and I am a 6-year survivor of stage 4 cancer.
6 years ago, doctors found a 12-centimeter mass in Michael's chest. Several times throughout our journey, we found ourselves in very dark places where we were very lost. It's so consuming to see the person you love more than anything in the whole wide world in so much pain. I wanted to expand on the idea of making lemonade by using it as a metaphor for hope and strength in the form of meaningful gifts. I'm a calligrapher, so I wrote things like "trying my best" and "you got this" on keychains and cards, and I gave them to patients and providers at our local cancer center. Just the feedback and gratitude that the Make Lemonade idea received, it gave me the ability to cry a different kind of cry. Instead of these hot, angry tears, I could cry these tears of overwhelming gratitude to our cancer community. And I could cry these tears of joy in being able to maybe play a small part in helping somebody get through what I know is a really hard time. Make Lemonade Project, our mission is to help cancer patients turn lemons into lemonade. And we do that through 3 programs. The first program is our lemonade stand, which we developed at our local cancer center. And it is for patients and providers to freely help themselves to uplifting gifts donated by local businesses throughout the mainland and around the world. We also have a grant program that we recently started for people in need of financial assistance as they go through their cancer journey. We don't want people to have to choose between treatment and the roof over their head and putting food on the table. We want them to be able to focus on healing and getting better. The third program that we have is our Stuff for When Times Are Rough, which is an online web shop that's filled with meaningful gifts. These gifts are all available for purchase on our website. You can find out more about us on our website at makelemonadeproject.com, and we'd love to see you on Instagram at makelemonadeproject.
So together, let's take all these lemons and squeeze the day.
So Make Lemonade Project is in partnership with social workers at Hawaii Cancer Centers to award financial aid grants to local cancer survivors fighting hard for their lives. For more information about the program, please visit their website at www.makelemonadeproject.org. So I wanted to take the opportunity before we go into a short Q&A to share some information about some clinical trials addressing financial wellness that are available here in Hawaii. So I wanted to first say, many of you may be already aware of clinical trials that address cancer treatment, but there are also many other types of clinical trials that look at ways to better support patients being treated for cancer. Additionally, clinical trial participation, not only are you getting the standard of care, but you're also may be getting access to additional support and resources that you may not otherwise have had access to through clinical trial participation. So just a few of the many reasons to consider clinical trials. So both of the studies I'm going to highlight are available in Hawaii. They're also open nationally. They're national studies. So this first one is called COSCOM. It's short for Cost Communication and Financial Navigation in Cancer Patients. And this is open to anybody diagnosed with a solid tumor cancer. And they also would need to have a prescription for a cancer medication. This is looking at, providing a little bit more financial navigation and financial counseling support one-on-one, and also helping to provide more financial planning information up front prior to cancer treatment rather than at the end. And they're looking to see if, providing more of this intensive intervention and upfront information about the financial planning process in regards to the cancer treatment would help potentially lower some of the stress involved that often comes along with cancer treatment. So this is really looking at two different groups. I know this is a really busy slide, but just to summarize, one of the groups would be getting a brochure that gives information about a nonprofit financial counseling service that's free. And then the second group would be getting one-on-one counseling sessions with a financial counselor. And they would have, I think, at least 4 of those one-on-one sessions, in addition to getting some cost communication upfront about the cost of their drugs. So if you were to participate in this study, you would be randomly assigned to one of these 2 groups, equal opportunity to be assigned to one of these 2 groups. And then you would be answering surveys at about 4 different time points throughout the year. So this study is actually open at all of our Hawaii Pacific Health locations, including Wilcox Medical Center on Kauai. And then the next one is credit. So that's another financial navigation intervention. The difference between this study and the other one, they are very similar, and they're addressing providing more support with financial counseling. But the difference mainly with this one is it's more targeted towards metastatic patients, so those with cancer diagnosed that is spread elsewhere beyond its original site, or those with a hematologic malignancy or blood type of cancer. One thing I want to really point out about this study is that it has been very popular and a lot of people have enrolled in this study. So if you are interested, I would act fast because it's pretty close to closing because they've gotten enough patients to meet their accrual goals to finish the study. And if you're interested in either of these studies or in participating in any clinical trials, please reach out to one of your HPH oncology providers for more information. And in particular, regarding these studies, if you'd like more information or think you may be eligible, you can actually reach out to our partners at the University of Hawaii Cancer Center. There's 2 research coordinators, Courtney, who covers Kapiolani and Wilcox, and then James at Straub and Polimomi. And I have their email addresses there if you want more information as well. So now we'll go ahead and bring back our panelists to take a few minutes to answer some questions. I think I already have a couple questions for Flo that are up here. So it looks like somebody's asking, are there asset limitations for financially indigent or just medically indigent?
Sorry, what was the question again?
Are there asset limitations for financially indigent or just medically
no.
indigent?
It's only for medical.
Okay, thank you.
You're
And then another question is for you as well.
welcome.
Military disability income and or military retirement income count towards liquid assets?
No, it will not.
Okay, so the answer to that was no, thank you. I don't have any more questions in the queue. I think that somebody else had asked Darren earlier about reasonable accommodation. I can go ahead and just read that off just so other people might hear the answer to that question. So the question was, reasonable accommodation can be requested as time off? And if so, then is it in the form of paid time off? And Darren had responded, yes, you can request time off as a reasonable accommodation. Typically, it would be unpaid time off unless you have PTO or paid time off, sick leave, or vacation banked. So I'll give another minute or few seconds to see if anybody else has any additional questions before we sign off today. So somebody had a question about contact info for Darren. I think he would be providing some of that information shortly on how maybe you could get in touch with him. Otherwise, it doesn't look like we have any other questions at this time. So thanks again so much to all of our speakers who took the time today to provide valuable information to patients and their families. We hope you found today's program informative and useful. If you do have any other questions regarding our services or today's webinar, please visit hawaiipacifichealth.org. Thank you again for joining us today, and we wish you a safe and healthy holiday season to come.